Hi, welcome back to Healthy Living. I'm here now with Kelly Rogers. Kelly is our Director of Home Health Services at St. Tammany Health System. And we're going to continue our conversation because this team does a lot of work in our community and they have a lot of services to offer that we want to talk about and expound upon today. So thank you so much for being with us, Kelly.
Thanks for having me.
You're
Great
welcome.
to be here.
So like we talked about, we're going to talk about home health services, but I do want to learn a little bit more about you personally and what you do for the health system.
So I've been a registered nurse for 28 years, and I've actually worked for the health system in home health for 15 years. So very passionate about that. I love the idea of taking care of patients in their home, which is a lot different than taking care of them in the hospital. A lot more obstacles and challenges that people have to overcome when they're home with not having all that support system that's in the hospital.
Yeah, so okay, well that's good to know that you've been there so long and that you love what you do. So we talk about home health, another kind of, it's not really as mysterious, I would say, as the last conversation we had, but it is probably often misunderstood about what is offered and what can be done and what we do, what services we provide. So can you give us a little overview of that?
Yeah, some of the services that we provide. So there's things that qualify you for home health services. You have to have a physician who's willing to follow you for those services, and it can be a nurse practitioner or a physician's assistant as well. They have to oversee your plan of care. You also have to be homebound, and where it's a taxing effort for you to leave home, but that's a little misleading sometimes because homebound doesn't mean that you can never leave your home.
Okay.
You can go to church, you can go get haircuts, you can do doctor's appointments and the things you need to do, but most of those patients and stuff have some kind of condition or have something going on that is holding them back from being to their previous baseline level. They may be short of breath, they may need to use a walker to get around. And then the other thing is that we have to have a skill to take care of that person in the home. They have to have a skilled need. And that's a little confusing sometimes too, but a skilled need is having a nurse or a therapist need to come into the home and help them, whether it's with education on new medicines, a new disease process such as congestive heart failure, diabetes. And it can also be the therapist working with them in their home. Say they've had a fall recently and they need some to get back to their baseline. They can develop a home exercise program for them. And they can also look at their home safety aspects and stuff to make sure they have all the right equipment, it's in the right places to help them get back to their prior functioning.
So it sounds like something that needs a frequent touch, basically, where it would be a lot for someone to go back and forth.
Yes, there are visits that we set up. So when we admit a patient to home health services, we set up a plan of care, and that patient knows how often the nurse is going to come, and if therapy is needed, how often they're going to be coming. And then we also have supportive services as well. We have a CNA, which can come in and help that patient with bathing and assist them with their activities of daily living until they get back to where they need to be. And also we have social services that's available too, because this day and time there's a lot of challenges and stuff for our patients, and they are able to come in and help them navigate that and help them with community resources, long-term planning, financial situations, different areas like that.
So it does sound like we in home, I say we, but home health, their goal, your goal is to again, nurture someone back to as independent of a state as they can get to.
Absolutely.
Right? But it's in their own home.
Absolutely.
So you come to them.
And just like with palliative care, we do the same thing. Each patient has their own goals. It may be that they want to walk to their mailbox and check their mail. They want to see those grandchildren or go on a trip with the grandchildren. So we're trying to get them back to that prior functioning level. So they're able to do those things and have that good quality of life. And our ultimate goal is that people want to stay in their home. They don't want to have to go to the emergency room or the hospital. They want to be at home. So that's our goal, is to keep them out of those areas.
And we do. We just recently learned about a phenomenal success story that home health had, and I know that the outcome was amazing for a congestive heart failure patient. So can you talk a little bit more about that specific piece of care?
Sure. One thing that we do that's a little bit interesting and stuff, and it's one of my favorite parts of things that we do in home health, is remote patient monitoring. So what we're able to do is take equipment and put it in the patient's home, and we're able to keep a check on that patient without actually even going into the home. We have readings that come across the computer system, and we're able to see, okay, did that patient gain 2 pounds today? Do they have something going on? Is their blood pressure elevated? And we have a nurse that oversees that 7 days a week. So they have somebody who's checking in on them basically every day without actually going and making a visit. So if we get an abnormal reading on the monitor, we reach out to that patient and say, you know, have you done something different? Did you have a change in your diet? Did you forget to take medications?
Right.
We try to get down to the root cause of what the reason is why they're having that change. And then we're able to intervene. They may have medication that they can take to help with that situation. We may have to reach out to the provider and say, hey, we have this going on.
Yeah.
Can you help us and give us some orders for what we need to do?
Okay.
So we've been very successful with the remote patient monitoring in keeping patients out of the ER and emergency room and
a
hospital.
really kind of an early alert system to any red flags, like you said, and then you can make adjustment in care.
Yes, absolutely.
So that is a very special feature, and I would imagine that it sounds non-invasive, and the patient is a participant, I would imagine.
Yes, and the equipment, it's not, I know that's one thing that's kind of intimidating sometimes to anyone, but it's real easy to use. It's a tablet, and it actually communicates to the patient. It tells them what to do. You're going to do your weight now. You're going to do your blood pressure.
Right.
So it's very interactive, and they get comfortable with it, and they'll actually retest on their own just to keep a check on things. So, and then we're in constant communication with them. So,
And that is wonderful. I would imagine it gives them another level of support and kind of a feeling of safety.
It does.
That someone is always in tune to the care that they need.
And the other thing that we also do is that, so home health is not, it's a temporary service. We're trying to get them back to their baseline. But when you do have patients who have a chronic condition such as congestive heart failure, it's something that they're going to have to learn how to manage. And that's a big thing that we do. A lot of education, you know, how you have to eat right, how you have to take your medicine, all the things you have to do to manage that condition.
Yeah.
And one thing that we do as well is once we get ready to discharge the patient from home health services and we're taking that remote patient monitoring out, we always make sure that that patient has that equipment in place on their own. They have the blood pressure cuff, a scale, pulse oximeter that they would need to monitor that condition ongoing, because we have to enable them to be able to manage it ongoing when we're not there.
Yes, and that gives them a little more independence. Is there anything else you'd like to add about what we talked about today?
One thing that comes up sometimes is there any age limit on the population that we take? Absolutely not. We do newborns to we've had 111-year-old is the oldest so far that we've had. But there's not a limit on age.
Okay.
One of the areas that the health system in general is trying to grow is their pediatric population and stuff. So there's a lot of plans for that. We're trying to do the same thing as well in home health. So we can help with those needs, even if it's a newborn who is having some feeding issues and stuff and needs some oversight, or may need some IV antibiotics. So there's a wide range of things that we can do for any age.
All ages. Thank you so much, Kelly, for being with us today. And thank you for watching. Stay with us, because when we come back, we're going to speak with Emily Puppo. She is our supervisor of palliative care, and she's going to talk a little bit about advanced care planning.